the underserved population, that's where you pick some of your patients from. What do you look out for before you pick these people?
Yeah, so underserved populations, when we talk about it, is basically our sub-region where we don't have expertise in managing complex deformities, just as you see on the screen. So we actually, if a patient has a spinal deformity, a parent can see it, a school teacher or school nurse can see it, a pediatrician can see it, the child may complain about it. So these can be picked up by the individual themselves, or by family, or by a physician. Most of the patients who have advanced diseases are referred to us by other doctors. So you can also establish a screening program which is present in some states in the United States and other parts of the world, whereby patients between ages 10 and 14 and 15 are screened routinely for spinal deformities such as scoliosis, because that is the time when it shows up. When someone, mostly in girls are 10 times affected by scoliosis than boys. So you may see uneven shoulders, you may see a rib prominence, you may see a trunk shift or waistline asymmetry, and those are subtle findings. But invariably, if you take an X-ray with these findings, you may see a curvature of the spine. So it can be identified by a layperson or a physician. In the advanced cases, physicians will refer to our center for treatment.
Why is your focus especially on underserved populations? Why did you choose that segment?
Well, so when we say underserved, it is not that it is not present in the first world countries. I was in the United States, I was a surgeon, and I was a professor for 25 years. Most of my patients were from the New York tri-state area and also from around the world. So it does affect regions where there is a tremendous amount of service. But when I say underserved, is because that here we meet challenges like we don't have enough specialists to manage these conditions. I can say that in Ghana, for instance, I'm probably the only spine deformity trained surgeon. That's 26 million people. In Nigeria, I can think of maybe more than 20 spine deformity trained surgeons. So that's underserved. If you have more than 100 million people, and you have less than 20 spine deformity trained surgeons, that's a huge underservice. And that's what is meant by underserved. It's not that it's a peculiar condition here. No, it is not. But we don't have the resources, we don't have the professionals, and we don't have the funding to treat these patients.
Okay. How much help are you getting? Because this organization is not for profit. How much support are you getting from organizations all over Africa, all over the world?
So our first support group is the Focos USA. Focus USA holds annual events to raise funds to support Ghanaian children who are not able to meet the medical costs for their conditions. And then also we have organizations such as the American Jewish Joint Distribution Committee. They sponsor Ethiopian patients to Ghana for spinal deformity treatment. And then there's African Surgery Incorporated, sponsored by an organization in the United States that brings in Sierra Leoneans to Ghana for spine deformity treatment, as well as hip and joint replacement. Then there are other groups like Seeds of Hope in Tanzania, places in Zambia. Unfortunately, there isn't any organization in Nigeria that sends patients to us from Nigeria. So Nigerians who have come to Ghana for surgery usually pay cash. And we try to give them discounts, and we call that subsidies, but that doesn't mean that there is it's for free, because nothing is for free. We still have to cover our overhead. So for the deficits, we do go outside and try to raise funds to bridge the gap. So the help that we're getting in Africa is from these organizations, and then also from fundraisings that we hold abroad in the United States, and then in other countries. Like we did a fundraiser last year in Hong Kong to raise money to support our patients. We also work with the local government the Ministry of Health in Ghana as a public-private partnership for consignments that we bring in from abroad to be able to do these operations. Otherwise, if we have to pay duties, it means we have to pass on the cost to our patients, and that would be prohibitive.
Please correct me if I'm wrong. We seem to hear more and more of people having hip replacements these days, something I didn't hear too much about when I was growing up. Is it that this is a more modern part of medicine, or the demand for it is getting more?
Well, hip replacement surgery has been in existence since the 1950s and 60s. Sir John Charnley of England first performed the hip replacement surgery, whereby an arthritic hip joint is replaced with a ball and socket prosthesis so that the patient is free of pain and has normal motion and can move. So it is an operation that has been present for about half a century now, and it has been done in several countries. It is becoming more popular here in Africa because now our surgeons are beginning to learn how to do that. There's a hospital here, Cedar Crest, that does hip replacement surgeries, and we also do that in Ghana. But to be a hip or knee replacement surgeon requires after training fellowship. So if an orthopedic surgeon has completed orthopedic training, they will have to have a year-long fellowship training in joint arthroplasty. That will then make them proficient to perform hip replacement. So patients have needed hip replacement surgery, but the expertise wasn't available.
All right.
And when you don't have expertise...
Okay, we just go on this break and we'll come back to continue the discussion. Just stay with us on Sunrise. Welcome back. We'll go back to our Abuja studios. Professor, is there anything you're planning concerning Nigeria? You're based in Ghana. What is it that you have up your sleeves concerning Nigeria and orthopedic treatment?
So Nigerian physicians are aware of our existence. As I said earlier, I have been here several times to give seminars and lectures. What we're doing now is to be able to continue to collaborate with these physicians to refer patients to us for treatment. And we also would like the Nigerian government, if possible, to recognize the need for this type of specialty and to help the institutions that have embarked on treating patients with spinal deformities. We can provide support for training. We have established many fellowships in Ghana whereby surgeons can come for months at a time to avail themselves to the expertise that we have there. So it is we are available to help in the training and the building of capacity, Ghanaians and Nigerians. And I also believe that patients who are not able to afford such treatment can obtain help either from the government or from private funders to be able to come to Ghana for surgery. At this moment, I believe Nigerians send a tremendous number of patients to India, for instance, for complex spine and joint replacement surgery. Ghana is only an hour away. So we are here to serve the continent. And you can fly to Ghana in an hour and get the same type of treatment and be home and save costs and also be able to have follow-up care at a very reasonable rate and also at a convenience of the family or the patient.
So you're saying, we don't need to go that far to India. Ghana is just our next door neighbor. We'd like to thank you so much for coming on this morning. We've been speaking with the founder of Focos, and Focos is Foundation of Orthopedics and Complex Spine, and they work through a team of medical volunteers around West Africa. Thank you so much. Professor Ajay. I'm trying
Professor Oheneba
Boachi Ajay. Thank you so much for being here. That name. Thank you. And so we go on a very quick break. Sunrise will be back in a moment.